For Sylvia Ramirez, the lack of mental health facilities in southern New Mexico makes finding help for her family a struggle. A Los Cruces resident and a housekeeper for Memorial Medical, she said that her family suffers from psychiatric problems, including her son, her mother-in-law, and her then-fiancé, who passed away in 2009 after battling mental illness and addiction. Ramirez said that the closure of Memorial Medical's psychiatric ward creates barriers for residents with mental health emergencies, and that having a resource for individuals in crisis should be a priority within the community.
We need the services here, not just for me in general, but for the community. Definitely for the community. There's so much help that can be done just by opening that one facility. You do have those situations where a person is going through a tough time and they need that emergency service, and there's nothing. Back when it was open, at least we did have that, where we can go get the help that we needed at that time. But now, it's really hard.
Memorial Medical Center closed their psychiatric ward in August of last year. According to their lease with the city and the county, quote, "If leasee ceases to maintain the hospital as a full-service general acute care hospital by not sustaining the same types and level of service as currently provided, leasers shall have the right to terminate this lease or retake possession of the premise by eviction, reentry, or otherwise." When KRWG reached out to Memorial Medical CEO John Harris, a spokesperson said he was not immediately available for an interview. However, in a written statement, the spokesperson said, quote, "The decision to close this floor was not taken lightly. A provision of these services has always been based upon being able to staff this unit appropriately and safely. Once this has been achieved, we look forward to bringing these services to our community." Peter Goodman is a Las Cruces resident and has written about this issue in his weekly column that appears in local news outlets, including krwg.org.
They claim to be near a solution, which is great. The problem is that a year without a mental institution creates so much harm. There are a lot of people that can't go to El Paso. There are a lot of people, you may know some, who are in a situation where they function borderline on the street or in their home.
Goodman said that he's pessimistic about Memorial's reasons for closing the ward.
We're seeing a private healthcare entity make decisions based on profit, and some other things they want to do, maybe new things, are more profitable than the fifth floor, which is a duty under their contract and a duty to the local humanity. And that takes a back seat. It seems, certain people who know more than I allege this, and it seems that way to me, that what the people need and what is required under the contract is taking a back seat to other endeavors.
Shannon Reynolds, Doña Ana County Commissioner for District 3, said that while Memorial may be in violation of their lease, it's in the best interest of the county to not pursue any legal action.
We have the contract. We can act on the contract. The problem is do we act on the contract to the point where we put them out of business? See, that's a delicate balance that we also have to consider. We need the services, we need the hospital, and we don't want to force them into a corner where they have to say, well, I give up. So we need them. We need to be a good partner with them. What I would say the best solution to this kind of problem is more competition. So if rather than having only one facility that can provide the service, we need multiple facilities that can provide the service. That also goes back to the economic atmosphere of the community.
As for Sylvia Ramirez, she said that she's hopeful for the reopening of Memorial Psychiatric Ward, but agrees that more needs to be done in terms of attracting mental health services to the area.
If my fiance at the time would have had the right counseling, the right assistance, maybe he wouldn't have gone into addiction and try to cope with his mental illness that way, and maybe he'd still be alive. You just don't know, because there was never those services.
Memorial Medical Center told KRWG that they are close to reopening the psychiatric ward, but could not give an exact date. For KRWG Public Media, I'm Johnny Coker.